If you're a runner over 35 dealing with knee pain, hip pain, shin pain, or even Achilles tendon pain, and if you've tried rest, generic PT, stretching, injections, and tried pushing through the pain, but the pain keeps coming back every time you run, then this video will show you exactly how runners can get pain-free in 90 days using something I developed called the athletic runner method. Now, most runners think that their pain is, just from being too tight or just inflammation or just getting older. But after working with hundreds of runners who come to me with injuries as a physical therapist and run coach, I can tell you the real problem is not just inflammation or tight muscles. It's faulty loading, poor mechanics, and lifestyle stressors stacking on the body. And that's why rest alone doesn't fix running pain. And that's why pain comes back the second you resume training. I help runners, especially 35 and up, pain-free and return to running using a three-phase holistic system, comprehensive approach called the athletic runner method. It's not just physical therapy. It's not just run coaching. It's a comprehensive runner health system. So the three pillars, right? We're solving running pain by addressing three things: the root mechanical assessment, really uncover what's causing the pain or the injury in the first place. A lot of times, even if you have like irritation on MRI, like your knee MRI shows have some inflammation in your knee or like a meniscus patient or patella inflammation. That stuff is usually a symptom. It's actually not the cause. That's just where you're feeling it. Oftentimes, the cause, we have to go a couple steps back as to the actual cause of the pain. We do a runner-specific strength and mobility, and then take a holistic, a lifestyle optimization approach, right? Sleep, nutrition, stress, and recovery. So it's not cookie-cutter rehab. It's not your generic training plan. It's definitely not just some random YouTube exercises. It's going to be personalized coaching built for runners who want to stay active for life and pain-free. So if you don't know who I am, I'm Dr. Peralta, a physical therapist, a run coach, Marine veteran, and I've dealt with years of knee pain myself. I was told to stop running, rely on pain meds, except that pain was going to be my new normal. But that just didn't sit right with me. So I studied movement, biomechanics, and performance, and eventually developed the athletic runner method after helping hundreds of injured runners return back to running pain-free, right? Busy professional, parents, marathoners, runners over 40, 50s, and 60s, right? And just a disclaimer, right? Individual results vary based on your consistency, your habits, and adherence to the program. So how the athletic runner method looks, right? Again, phase one is the comprehensive runner assessment, the foundation. We try to uncover the root causes. We don't just look at where it hurts, right? We analyze your form, your gait mechanics of running, walking as well, strength imbalances, mobility restriction, how your back, your spine, your lower body as well. Treatment patterns, training load histories, sleep, stress, and recovery habits, nutrition and body composition, right? Because even if you're overweight, that can impact your health as well, and also running injuries. Because running is rarely just about the isolated area where you feel the symptom. Like knee hurts, not just about the knee. For example, hamstring pain can come from the spine. Knee pain can come from weak hips. Achilles tendon pain can come from poor lead management, just your programming when you're training. See, most generic PT clinics only treat the symptom. Right. And I'm not saying you might not get some relief. The problem is when you go back to running at a higher level again, the symptoms come back. And then you're like in this boom bust cycle. You keep getting hurt every training block. When you work with me, we help you identify the mechanical drivers, but also look at your programming to make sure you make smart training decisions as well. Phase two, strength and mobility progression. Once we find the root cause, we move into structured rebuilding. Instead of random rehab exercise, you get runner-specific strength programming, progressive loading benchmarks, mobility that supports your mechanics, and a clear criteria before returning to higher mileage. A lot of people don't know this, but running is a high-impact sport. Anywhere to 2 to 3 times your body weight every time the foot hits the ground. So if you're a 150-pound runner, that's 300 to 450 pounds of force going through your legs. Your leg, on a single leg, by the way. So that single leg has to be strong enough to handle the demands of running. And so we use benchmark testing like strength testing, hop testing, gradual load progression, and different strength attributes. So then you can safely return to running. So you're not guessing when you're ready to run more. You'll have clear benchmarks. So this dramatically reduces re-injury risk, especially if you're a runner who's 35 and up. And then the third phase is the holistic runner optimization, right? This is the missing piece. This is where my method has evolved, because pain is just not mechanical. It's not just the joint or the muscle or the tendon. It's also influenced by sleep deprivation, stress, poor nutrition, right? Either undereating or overeating, overtraining, or maybe even undertraining, lack of recovery. So we optimize for sleep, making sure you're getting enough proper quality sleep, right? At least 7.5 hours or more. Inflammatory nutrition habits. You're eating foods that are not inflaming your body or causing systemic low-grade inflammation. Hydration, right? So you're properly hydrated. Smart 3 runs per week programming. Recovery routine for a busy schedule. And that's why my clients don't just get pain-free, they stay pain-free. So let me tell you about Anna's a runner who I worked with about 2 years ago or so. She was a 45-year-old mom of four, chronic back pain, hamstring pain, and she had Achilles tendon pain for years. She tried PRP injections, multiple rounds, cortisone injection, months of rest, the generic insurance-based physical therapy. Tried pushing through the pain. She would get temporary relief, but nothing really worked a long time. Anytime she tried to build back up to the marathon, and she was a woman who loved to run multiple marathons. I think she ran over 11 marathons when I started working with her. And every time she returned to running, the pain would flare up. She will seriously consider quitting marathon running altogether, maybe switching to biking or roller skating. But after her assessment, we discovered something critical. Her hamstring pain was actually referred from her lower back, her back mechanics and mobility. So instead of just doing endless hamstring exercises like hamstring stretching or hamstring strengthening, we corrected the true mechanical driver. We implemented spine-specific corrective movements, right? So mobility drills for her back, which are actually improving her hamstring. We also looked at her ergonomics, her posture, and other lifestyle factors that were influencing her pain. Reduced her running from 6 days a week to 3 days a week. Did 2 times per week of strength training, right? 30-minute sessions, and sleep and recovery optimization. And so results. And within 3 weeks, the pain dropped dramatically. 90 days, she was pain-free and back to marathon training. She completed New York. We were working together during the fall, and she went back. She did the New York City Marathon. It was like her 4th or 5th time. No surgery, no injections, and no quitting running. Again, individual results vary, but the principle remains the same. Fix the root cause, sustainable pain relief. So common concerns. You might be thinking, I've already tried physical therapy before. So most physical therapy is just diagnosis based, right? They get the doctor's order. It says runner's knee or IT band syndrome or shin splints, right? It's not runner mechanic based. So even though the PT may say they do sports, whatever, they're not really specialized in working with runners. And oftentimes, again, you'll get a plan that's catered to the medical diagnosis to treat the body part, right? They usually just treat the body part, and maybe they may give you some exercises, and then they just send you off. And maybe you work with them for a few months. You might get some temporary relief, but then the pain comes back when you start running again. The other concern, I guess, need rest, but mechanical pain rarely resolves with rest alone, right? You could try resting, but again, the minute you go back to running, it's not the body. You haven't conditioned your body to handle the demands of running, so then you get hurt again. I could just find the exercise on YouTube. I could find generic things online, but without an assessment, you're just guessing on the root cause. Like, oh, my knee hurts. I'm just going to do the knee exercises. But what happens if the knee pain was actually coming from another source, the hip or the back? Now you're just doing the wrong exercise and just wasting time. Or the big one, I'm just getting older. The truth is, I work with runners in their 40s, 50s, and 60s who return to pain-free running once their training and mechanics are properly structured. So who is this for? The program is really for runners who are 35 and up, dealing with persistent pain or pain that's not getting better with the traditional methods, right? Maybe you had the pain for 3 months or more, 6 months or more, right? Professionals or parents with limited time, people who want to run the marathon or half marathon, and anyone else. Maybe you're military personnel, law enforcement who just wants to stay active, you want to pass fitness tests or did not get injured. This is not for people looking for the quick hack, people unwilling to follow a structured plan, those are expecting an overnight fix. There's like, just show me the random knee exercise, I'll be fine. That's not how it works, right? Even if you get an exercise, there's other factors that go into it. It's not just the exercise alone. It's not just, showing a PT technique or whatever, right? If that stuff worked, you would have already got better with traditional PT or the, generic, exercises you would have found online, right? So you have 3 options: keep guessing, resting, and re-injuring yourself. Option 2, rely on injections, meds, or generic programs. Or option 3, work with me inside the Athletic Runner Method. Fix the root cause so you can run pain-free for the next 10, 20 years, right? Into your golden years. I currently only accept a limited number of private coaching clients because this is high-touch, one-to-one comprehensive program. It's not just sessions. You get ongoing support, app coaching, and check-ins. So if you want to run pain-free, get stronger as a runner, train smarter, not just harder, and stop the cycle of recurrent injuries, click the link below and book a free runner strategy call. We'll assess your situation, identify likely root causes, map out a 90-day pain-free roadmap. Spots are limited, and once they're filled, enrollment closes because your running career shouldn't end due to preventable pain. Apply now, and let's get you back to running pain-free in 2026.